Welcome to Startup Health Now, the weekly show celebrating the health transformers and change makers reimagining medicine. My name is Stephen Krein. On today's episode, we have Eran Kabakov, the co-founder and CEO of Docola. This is going to be a great episode.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. Well, I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say be solved if we have the will, the courage. The future is to those who take it.
Erans, welcome to the show.
Thank you.
It's exciting to have watched you grow over the last 9 months. I think you've been in Startup Health, and really intrigued by what you're doing, not just because of the solution, but because of your background, because what we've seen over the last probably 5 years or so is a whole slew of clinicians and other healthcare professionals like yourself get involved in entrepreneurship. So tell us a little bit about yourself.
Well, as you mentioned, I'm a clinician. I've been in healthcare for about 25 years, the background is really more than just one specific. The majority has been in physical therapy, but I've been in many other healthcare positions. So it really is a passion. If I could make money in healthcare, I'd be still doing healthcare. That's the background, really. Back in 2001, I was in the clinic. So, because 4 patients, and I came out of the room and I said, we got to do something better. If we keep doing it this way, it's just not going to work. And that's when I started designing what we have today.
And so, before we jump into Docola, because I want to understand a little bit about when you were practicing technology, integrated into what you were doing, not integrated. How did you view? When
I started, there was no technology. It was paper charts, very, very, very basic. Now, let's put it in perspective. Physical therapy is, one, super hands-on, and B, is very heavy in education, right? If you want to have successful outcomes, you have to educate the patient on what to do. So the need for me was more urgent to figure out what to do. But when you look at the clinician's day-to-day life, the majority of it is not patient care anymore, right? It's administration, it's billing, it's insurance verification, and it really plays into it wears off the magic of being a healthcare provider. You go to school because you want to help people, you get a job, and all you do is paperwork and administration, and it wears you out. And that's really what led to the founding of Docola. Yeah. All right, so tell everybody that's listening what Docola does. Sure. Docola is a patient communication platform. We help healthcare providers aggregate information from any source, combine it into courses, and then prescribe to individual patients so that they can view the information anywhere, share it with friends and family. And on the back end, we track participation so that there's a clinical record that the patient interacted. It goes back to the clinician.
So for those who might say, I have WebMD, I have Google, I have so many other ways of getting educated, why does this matter? And how is this different?
Absolutely. The problem with the Dr. Google, right, is that it's overwhelming. And how do you, as a patient, distinguish between good information and bad information? So you have to sift through a lot. Our focus was on reconnecting the patient and the clinician, right? The information that we want delivered is from the healthcare provider directly for the patient. When you ask patients and when you look at research, when you look at surveys, patients want the healthcare providers to give them the information. The reason why WebMD and Google Doctor Google is so successful is because healthcare providers today are unable to provide information within the way healthcare is structured. We have 6 minutes, 7 minutes. In that within that time, I have to identify what you have, how to fix you, and get billed and everything else. So communication falls by the wayside, and as a patient, you're left to fend for yourself. And look over the years. So we have WebMD, and then we have patients like me and patient communities that basically came out to say, I need answers. I'm not getting it from my healthcare provider. Where am I going to do it? Oh, there's other patients, and that's the solution. And as a healthcare provider, as I'm saying, that's our biggest failure as healthcare providers, is that the person that we're taking care of, we basically let go because. Not because of our fault, but because of the structure of the system.
So if you wave a magic wand, look out 10 years, what does the world look like with Docola in the hands of both healthcare professionals and patients?
The same relationship, very simplified, but really the same relationship we're able to have with social media sites like Facebook, right, and Instagram and all those. The same relationship happens in healthcare. So when you go to your healthcare provider, they're able to give you information that is relevant. That's a very special word to me, relevant to you, not just clinically, but also as a person, so that you can better care for yourself and have better healthcare. That's the 10 years from now. That's what it is.
And who's instigating that? The doctors, the patients, the insurance companies, the hospitals, the pharmaceutical companies? Who's actually going to make sure Docola's in the hands of the right people?
It's going to be from the healthcare provider. The healthcare provider is the front line. The idea
So is that who you actually sell to and you're trying to educate right now?
Yes, because when you look at 10 years from now, so fee-for-service is dead, right? There's no more fee-for-service in 10 years. We're looking at value-based medicine. We're looking at population healthcare. The only way to be able to practice at that point in time would be to be efficient in your day, right? But also support the patient in a way where they can be part of the care team. They can come on board.
Does Docola make it easier? Because it sounds like you just talked about all the reasons why it's difficult to be a practicing clinician today with all the paperwork and admin stuff.
Yeah.
Is this just yet another thing they have to manage and worry about? They have their EMR. They have so many things, like you have to scribe into the EMR today. How does this make it easier, make it attractive to the doctors?
What we say is that you clone your knowledge. You have to clone your knowledge once, right? And once you do, you can prescribe it as many times as you need. It makes it much easier because of that. So yes, there is an investment of time and effort in making the first one. And by the way, effort, it means that you turn your phone on, you talk into your phone and save it into the system. That's what most people do nowadays with Facebook anyway, right? So it's not complicated technology-wise, but you just have to have the message for the patient. That's it.
So ads work initially, decreases it over time? Is that the setup is kind of time consuming, but the use of it is where you save?
Yes, absolutely. Because you can, again, we actually have followed clinicians. So we went behind them and we had a timer, right? And then we also were following up on what they were saying to the patient. So when we were walking from room to room, doing the surveys of what the clinician is saying, the amount of time that they were spending was pretty much the same. The information was completely repetitive. So that means that if Docola can save a provider 2 minutes in a room with a patient times 40 patients, we just open up 80 minutes. Right? Did I?
Yeah. Let's assume you did.
Yes.
And I got to ask, what are the alternatives today? Because it seems like, and I hate it, patient engagement, a very overused term. Everybody thinks they understand it. You threw out population health and other overly used and misunderstood term. Help me understand kind of what the landscape looks like today. Why is this different? How is this differentiated from what might be a solution out there, or the alternative not just being manual?
The solutions out on the market today cater to what I call the old healthcare structure. So a lot of them are protocoled. The information is basically, as a provider, you either you pick from pre-packaged questions, answers. It's still somebody else providing information to the patient. It's not the provider directly.
What are some of the tools they might use to do this now?
Today?
Yeah.
Well, there's the many texting apps. Do you want specific company?
Yeah, I'm just.
Well, you have the Health Loop and
All right, so let's use that. How's this different than Health Loop?
Well, Health Loop is a texting message. It's a texting system that basically when you leave the doctor's office, it will text you and say, Steve, how are you feeling today? Are you feeling okay? You say, yes, I am. When they get the response, they say, okay, great, make sure to take your medication, okay? And then they just keep pinging you with a text message. That's great, right? But, adoption is still questionable, I think. And it's not seeing you, the doctor, telling me what I should be doing. Right. So with Docola, what would happen is I come in and see you, and you tell me a story for, let's say, 10 minutes. I leave the room, and as soon as I leave the room, by the way, I only keep 20% of what you told me. I go home, and my wife says, Eran, what did Dr. Steve say? And I say that maybe the 20%, and that's it. And so the difference here, what we're doing, is we're enabling you to take that story. Now I say to my wife, I say, I have this video, we can watch it together. And in there, you stress the importance of medication adherence, right? Now, where is the value of, is there value for the texting apps? Absolutely, there is. But it has to be part of a overall communication solution, right? The texting by itself, to me as a patient, would be annoying, because basically what you're doing is you just saw me for 6 minutes, and now to kind of fend off, you say, here, some automatic texting messaging. I don't want texting.
Gotcha. So you're not leaving them with the full education in their pocket.
Yeah.
Tell me a little bit about when you actually think about who is using your product today that is a raving fan, that tells people or other colleagues or peers about you. What are they saying?
The first thing they say is that they love the customer service. Okay, we're very hands-on, so we hear that a lot. From a technical standpoint, it's just the amount of time they save. They say we're just saving so much time.
Is that the biggest take-home value?
Yeah. Right now, yes.
What's the data look like around time savings?
It's almost 3/4 of an employee, full-time employee, when they flip us on. So, that's a significant amount of time instantly. Now, we always tell the clients, it's not like you're going to fire somebody, but that person can now, you have 3/4 of an employee right off the bat. I think that as the system grows and we are able to integrate with other technology solutions, which is absolutely something we want to do, because in 10 years, collaboration is going to be key. If you don't collaborate, it's not going to happen. Once we collaborate with other technologies, we can actually increase the time savings and the quality of care.
All right, I'm going to shift away a little bit from Docola and go back to you, because unique background, the clinician, the entrepreneur, serial entrepreneur. Life as an entrepreneur this time around. Biggest challenge?
Fundraising. Money is key. That's the biggest challenge. You do it a few times, you get better with managing a team, working remotely, being smarter about running the business. Money in healthcare is difficult, I think. We're still investors are still trying to figure this out, how to actually quantify what we're saying. It's like that's the biggest challenge.
Do you have a team that understands the uniqueness or the difficulty of operating in this sector? So I don't know how much of your team and the developers and the people that are involved have done healthcare before, but something they're used to or not used to, because in this sector, it's so different in terms of both the receptivity, the understanding, the kind of embracing of digital health startups, oftentimes by non-healthcare investors, difficult to understand. How's your team in terms of support around that?
So this time around, the team is myself. My one partner is a surgeon, young surgeon, which I think is critical, because he actually, through our conversations, I've learned things. I'm a physical therapist, so my circle is physical therapy. Hearing what the perspective of the surgeons, the young doctors, is amazing, because there's such disappointment when they get out into the field and not being able to do what they've spent years to get to work for. So he totally gets it. He's also into technology, so big time. My other partner actually has some healthcare background, but he's more into technology. What was interesting to me is the development team has no background in healthcare, but there were so many aha moments. They are full-blown digital health technologists. I mean, they
got the bug.
We have to make this work because this is good, and it was really nice to see.
So where are you having the most success today in terms of not just Docola, in terms of the team, in terms of entrepreneurship, your entrepreneurial background, your entrepreneurial efforts, and now Docola? Where's the success and where are you kind of leaning in terms of momentum?
Team-wise, I think the success was just being able to put a structure for the company in a way to position us to do the best we can. So the team is ticking on, all 8 cylinders are ticking great, which is good. The story has been honed really well, and I'm giving a shout out to Startup Health. It's a great organization, but coming into Startup Health, we had a story, and through the process, we really distilled it in a way where it's very effective today. So when we do have meetings with investors, with individuals, the story gets through. That's been a huge part of the current success and the momentum that we have.
What's the biggest misunderstanding you have to deal with on a daily basis about either what you do or the space you're operating in? What do you wish you could shake people and go, you need to understand?
Healthcare is 20% procedure, 80% communication, okay? The solutions in the market most of them are going and focusing on the procedure, which is only 20%. Healthcare is communication. You don't communicate well, there's not going to be improvement, right? In order to communicate better, healthcare has to change. So, people say, what do you do? And I go through my spiel and they say, oh, so you're doing patient engagement. I'm like, no, we're not doing patient engagement. We're not doing patient education. We're doing communication. We are optimizing communication. That misunderstanding about how important communication is in healthcare, that's my shaking moment.
Excellent. All right. So, favorite tools that you use on a daily basis? What's on your phone?
Spotify. Gotta have music. First thing first. And there's a little small app that I use for food called Kachow. Nobody knows about it.
What does it do?
Basically, it's like a roulette. You hit a button and it tells you where to go eat. So you don't have to make the decision of like, I have to have lunch. Where am I going to have lunch? You go. It goes. It gives you 3 options. You click. There's a map. You go.
Excellent. We'll have to figure out where we're going for lunch today.
It just takes out the decision making. Skype, WhatsApp, staying connected, for sure.
Excellent. Okay, so last question. We talk a lot about the healthcare transformer mindset, the idea that it's all about how you're thinking about and how you're living in a world where you have the transformational mindset continually reinforced. Which of the mindsets for you was the one that you've made the biggest improvement on since you started in Startup Health? And kind of, we always talk about it being like a muscle and you keep getting better at the mindsets, but which of them resonates the most for you?
I think that the eliminating the negative, being very aggressive about, maybe that's not a good way to use, but aggressive about eliminating negative thought around me. Mm-hmm.
That's the batteries included, batteries not included, where you're actually just not tolerating batteries not included people around you.
It was somewhat easy for me to do it in the business world, right? But I wasn't really paying attention to the personal life,
mm-hmm.
And so, taking that to the next level and really just saying, no more, definitely made a big difference.
Ron, it's been great to see you so far making progress. I know you've got great things ahead. Excited to be not only helping you, but obviously seeing how this is going to transform healthcare in the coming years. Thanks for coming on the show and look forward to having you back to hear an update in the near future.
Thanks for having me.
Thanks, man.